Welcome to Second Cup on WTXL.TV. Dr. Chris Tomshack joins us this morning. He's the founder and CEO of HealthSource Chiropractic. Thank you so much for being here this morning.
Thank you. It's great to be here.
Now, with the holidays, there's a lot of aches and pains that come with that, and people often, go to the doctor and get prescribed pain medication. But you're saying that there is a holistic way to manage pain. Could you tell us a little bit about that?
Oh, certainly. As a matter of fact, in 2016, the American College of Physicians came out and said that when people have back pain, especially chronic back pain, which seems to be really prevalent at this time of the year, opioids or those types of narcotics should be used, not as a first choice, but more as a last choice. Other alternatives such as chiropractic or acupuncture or even massage should be employed as a first line of defense.
So that is still what you're hearing from the doctors, right? They often say, hey, try this first before prescribing the pain meds, or are we hearing that that's kind of gotten lost in translation?
That's a good way to put it. It has sort of gotten lost in translation. And we know that because the escalation of opioid-related deaths right now is increasing. Even with all the press that we've seen over the last 24 months, it's still continuing to increase, although it looks like it may be slowing. So the message, I think, is starting to get out, which is why we're doing this.
So how does one manage their pain by going to see a chiropractor and getting adjusted?
Oh, great. Okay, so it's very simple. Picture, if you will, a rusty hinge. So you think of a hinge that's been sitting out in the rain for 10 years. It's got rust on it, and you try to open the gate, and it doesn't move very well. Well, that's kind of like what happens to our body in a similar fashion. The joints in our body can become fixed or stuck, if you will, and they don't move as well. So what a chiropractor does with today's modern chiropractic care is provide gentle manipulation, gentle adjustment to begin to move those joints so that they're moving like they're supposed to, so that they feel better, they're not locked up, and you can move again.
And that is what causes the pain, right? Is not having loose joints and kind of getting stuck like that rusty nail.
Exactly. It's exactly what it's like. So our body's designed for motion, and when we're moving, we're healthier. We're much healthier. The blood's flowing, everything's moving, and that's how we are designed to function. When the joints become locked up, well, that's what leads to a whole cascade of effects. So now we are here moving into the holiday season. You go to lift a heavy present, or you grab your luggage to go visit Aunt Edna, or you bend over to tie your shoe, and all of a sudden your back spasms and you can't move. Well, rather than go the opioid route, let's do what the American College of Physicians says and go a different route, because it's safer and oftentimes more effective.
And probably feels a whole lot better too.
Oh, most definitely.
One thing that I think we should maybe talk about is health insurance. Do the majority of people's health insurance cover going to see a chiropractor? Today
it absolutely does. I'm going to venture a guess over 85% of insurances do. So it's very rare that we see someone come into one of our offices that doesn't have coverage with their particular plan.
Okay, because I know that's probably what a lot of people are thinking. Does my health insurance cover something like that? Now, what about if someone is already taking pain medication? Are they able to get off it through seeing a chiropractor? Or?
Sure. Well, it depends on what's causing the pain first, right? If it's in our wheelhouse, chances are extremely strong that we can get the patient off the medications. So we have to determine, let's come up with the correct diagnosis first. And so if that's what we deal with, we will dive in and help that patient address the problem, why they originally prescribed opioids. Because remember, let's just take a little jump here. And people who are using heroin, which is a very strong opioid, 80% of them started because of some sort of chronic pain. Not on heroin, obviously, but on a prescriptive opioid, and over 50% from back pain. So it can be a very slippery slope. And if you're given a prescription for opioids for just 31 days, which is not very long, you've increased your chances of permanent lifetime addiction by 30%.
Wow.
So if we can avoid that and address the reasons why the person hurts in the beginning, we're in a much better off place. The patient's in a much better off place.
I wish we had more time, because I'm sure you could talk more about this and why it's definitely the best alternative. But we will post more information on our website, WTXL.TV. Thank you so much for being here.
Thanks for having me.
A look at midday when we come back.